This next question, I can hardly bring myself to say the word because it gets everyone very heated. The word is super spreader. You remember that one coming up from time to time. Anyway, what is a super spreader? And then as a supplementary, why hasn't the Villa Gaiety show that has been listed deemed a super spreader? In fact, it was deemed a low risk, wasn't it?
Yeah, so taking the two parts of that separately. So first of all, a super spreader. I don't particularly like the phrase personally, I must be honest, because it tends to suggest the person has done something wrong when they may not have done anything wrong and may not even know they've been infected. A super spreader is someone who's been at multiple different events, and off the back of that, there is multiple chains of transmission emerging. So, for instance, if someone, a prime example of that was the issue with the Austrian ski resort at the start of COVID-19, where you had someone who was at the Austrian ski resort, then went off and did other things elsewhere. And off the back of that, there was multiple chains of transmission appearing all over the place. That's a super spreader. In terms of the panto, one of the reasons it was classed as low risk was because by the time the person developed symptoms and presented, if you look at the dates they were actually there, it was already a good time period since then. So if there was anything that was going to come off the back of that, we would have by then been expecting to have seen quite large chains of transmission and people coming forward with symptoms and presenting, because it had been, I think at that point, about a week and a half, nearly the full 14 days since that had happened. It therefore was deemed low risk.
I had to attend 2 COVID tests, day 1 and day 13. Each time I had to call for results, as apparently there's some glitch on the system which won't allow them any email results to go to a manx.net account. Others using things like Gmail are getting results the same day. It seems strange that many local people using manx.net receive a lesser service, especially when they can email confirmation of new appointments without any issue. It also puts more pressure on the 111 team, who have to take additional calls as a result.
Yeah, the 111 team sits in Cabinet Office. I'll be honest, I'm not aware of that, but I'll happily take it away and look to it and speak to Cabinet Office about that. If there is a technical problem, I would hope it could be overcome.
Because there's nothing worse than missing an email. I mean, it does happen.
No, and certainly I'm very technological minded. I'd much rather if people can get the results electronically that they do get, and rather than have someone having to do a physical phone call. So I'll speak to Cabinet Office, who runs the 111 system, and see what that is.
Okay. We've been advised that by David Ashford that patients will be getting the vaccine subject to medical sign-off. If medically given the all clear, is the vaccine administered immediately or is there a delay? If there is a delay, what are the timeframes and how do they see this working? Do they have enough vaccines for patient transfer? I ask this as my husband was originally told he had sign-off from doctor, but no vaccine appointment available until the end of February. I emailed Mr. Ashford with regards to this and chased him again as my husband is away on the 21st. We have since had a call asking us who our consultant is, as they don't seem to know. We have now been told that he won't receive the vaccine as you have to have both 3 weeks prior to your travel. Yet some have received the vaccine. I know a patient who received it yesterday for travel on the 20th. Also confusing is my husband today received a shielding letter from a different consultant, so really have no idea what's the best thing to do or who to talk to.
Right, well, in relation to patient transfer, yes, we are looking to vaccinate patients before they travel. It won't be, where possible, we would prefer them to have both doses before they travel, but that isn't always going to be possible. It has to be medically signed off by the consultant, because there are people with certain medical conditions where it might not be advisory for them to have the vaccination. So we do need to have confirmation from the consultant who knows that person's condition that they actually can have it. Patient transfer won't have the information around who's under which consultant, so they will have asked who that is. I know, so as far as I'm aware, we have got the vaccine to do patient transfer. We wouldn't have brought the system in otherwise, and that we generally will vaccinate depending upon when their appointment is. So it would be based around how far out their appointment is. But if the lady gets back in touch with me, I've had quite a few on patient transfer, so I can't necessarily recall which particular one this is. But if she gets back in touch with me again, I'll certainly raise it around her husband.
How does this work with you, David? Because, I mean, people come straight to you. I mean, do you see all these emails, or do you have to have them filtered by your staff?
No. I do my own. I do my own emails. Obviously, I have office support as well, where I can forward things on to get the answers. But yeah, it has been a bit busy, should we say, over the last couple of weeks.
What sort of numbers are you talking about letter-wise?
When the lockdown came in, I was averaging 100 emails an hour.
An hour?
An hour. For the first couple of days. It's slowed down a bit now, I'm happy to say. But when lockdown first came in, I was averaging about 100 emails an hour and around about 30 to 40 phone calls a day. So interesting volumes, but hopefully I've managed to get through most of it and reply to most people.
Okay, we're going back onto finance with this one. I hope this you can deal with. A response from the NFU Mutual back in May 2020 was their policy wording did not allow for business interruption insurance claims under global pandemic circumstances. I contacted the local NFU Mutual office and only to be told that the NFU policy wording was not included in the Supreme Court proceedings, and thus the validity of claims still remains the same. However, they asked me to call back in 2 or 3 weeks' time in case the head office had reviewed or changed their standing. Any advice in this direction?
This will be related to the business interruption insurance in the case that, as you've rightly said, Paul, was before the Supreme Court in the UK. There was a test case in relation to whether or not business interruption insurance covered a viral pandemic. The ruling went against the insurance companies. They appealed that ruling, and the appeal has now gone against them as well. So that those particular insurance companies will have to pay out. Now, it was a test case brought by a conglomerate of parties around multiple different companies and their wording. Obviously, not every single insurance company was included in that because the wording differs according to policies and companies. But I think now that most insurance companies, I would imagine, will be reviewing their stance in light of that ruling from the Supreme Court. From memory, I think, like I say, I'm losing track of days now, but I think the ruling only came through something like Wednesday or Thursday last week. So I would imagine quite a lot of insurance companies, including the one mentioned, probably now in light of it, although they weren't part of that action, will be reviewing whether or not they need to change their policies and their stance.
My mum, who is 90, got a letter today, so I phoned up to make appointments, but was told cannot make one as all booked up until the end of February. So we're probably going down the same lines.
Yeah,
here.
So again, a chance for me to reiterate the point again. It will take to that sort of period of time to vaccinate all of the over 80s. There's 4,800 people in that category, and we can only vaccinate as quick as supply. And as I say, at the start of the vaccination programme, it will look like it's steady numbers because that's the amount of supply the UK is getting and we are getting. But then once you start hitting March, as the manufacturers produce more and more, that's when the amounts start going up.
Will people who are self-isolating due to regulations, not symptomatic, be allowed out to receive the vaccine as they are allowed out for testing on day 1, 7 and 13?
But if someone is isolating at the moment, my understanding is they shouldn't be going out and about. They've got a direction notice, and equally the recommendation is the vaccine shouldn't be delivered to anyone who either has COVID-19 or I believe is suspected of potentially having it. My understanding is within the protocols there is a piece around that someone who is known to have COVID or suspected of having it shouldn't have it until potentially any symptoms or any isolation period is ended.
This is quite a long one. The ministers have emphasised how important it is to have rigorous isolation of potential patient transport returnees, as they could bring the virus back with them. Such patients are not travelling for the fun of it, some serious conditions needing travel across, and thus very susceptible to serious illness and death from the virus. 30 December 2020, Tynwald, Mr Morehouse asked about the possibility of fast-tracking the vaccination for patient transfer patients, and Chief Minister replied that he was sure the DHSC would put such patients at the first, subject to checking that it would be okay.
Yeah, and that procedure is in place. We've just discussed that patient transfers can be vaccinated. It requires their consultant approval. The one thing I do need to be clear on is just the start of that question there, where it says about restrictions on patient transfers. The restrictions are everyone coming into the island. So anyone coming into the island that isn't going back to an empty home, they have to isolate away from the home. The patient transfers actually have an exemption to that where the clinicians patients believe there is a clinical need for them to be cared for during their period of isolation, then they can be cared for in the home with the whole household isolating. So it's not just a rule around patient transfer, it's all travellers.
And just part B on that, on the 8th of January, the patient transfer website was updated, re patients contacting the Nobles Hospital consultants re-vaccination prior to travel. In a conversation with the Nobles consultant on the 14th of January, we were informed that consultants are being inundated with requests, but none have any information whatsoever on the vaccination for patients. So it appears nothing has been done to give any priority to such vulnerable patients. The numbers are relatively small, less than a dozen a day, and would have very little impact on the programme for vaccination for the elderly.
Yeah, I'm happy to go back and check, but my understanding is the protocols are in place. Certainly conversations I've had, that was discussed weeks ago, but I'm happy to go back and check, but my understanding is the process is in place for people to be referred for vaccination.
And finally, I did an interview about the taxi driver and the potential that there could be less taxi drivers willing to do this service because of what's going on, and they're having to self-isolate in a sense or have their windows done, and there's all sorts of goings on. Any updates on that? Has there been the protocol completely sorted out?
Right, I haven't seen the interview you've done with Mike, but I know Mike. I know Mike personally. So in terms of that, the taxi drivers have protocols they have to do when taking people through through the test centre. As long as those protocols are adhered to, they are classed as low risk. So if a positive case comes back, although the taxi driver should be informed, and I think Mike raised in the interview with you because I've spoken to him since. Like I say, I haven't seen the interview, but I've spoken to him. He wasn't informed about one. I believe he was informed by the person, not by contact tracing. So I have asked for that to be looked at by public health. But in relation to taxi drivers, if they're wearing the mask, if the person is in the back diagonally to them, as long as they've got the cleaning regime that they're supposed to do in place and the taxi is ventilated, then they are actually classed as a low-risk contact. So they don't have to isolate if a case comes back positive.
And I know time's up almost, but just to go back to what the future has in store for us slightly, just remind us about how many days clear do we need to be before we can start relaxing things here?
So ideally, we want to see 14 days without any form of community transmission. That's not around relaxing, that's around really opening up. So we need to be careful with our terms here. Relaxing is where we may do a staggered approach like we did last time. Opening up is where you go for more widespread things and returning back to normal. So what we need is 14 days where we didn't see any type of community transmission or unknown cases popping up. After that, we could start being more comfortable that it's not potentially out there in the community. That's still not a guarantee that it's not, because as we know, some people can incubate past 14 days or not recognise symptoms, but it would be a positive sign that we can move forward.
So you accept that it could be over 14 days. But going back to this whole thing ages ago when the vote in Tynwald about having a test at 13 days, you didn't go for that, did you, at the time?
Well, no, there wasn't a vote as such around that. In terms of it, what we said at the time, if it's the debate I'm thinking of, was that it was something that we were looking at, but we had to be absolutely clear what we were going to achieve by it. So we were looking at all our different testing principles at that time, including the midpoint test, which we've got in now, the test on arrival and the test on day 13. And we had to make sure we were geared up to be able to do that. We could do it from a microbiological point of view. But as we've said time and time again, we've got to make sure the resources in place and what exactly we're looking to achieve by it. We've had long debates with Director of Public Health about mass testing and the pros and cons of that. Equally, with any form of testing we bring in, we've got to be absolutely clear what we are actually going to achieve by it.
And have you got the data back on which strains we have here in the Isle of Man? Because it seemed, unless I missed it, that we still haven't had that information back, and that's so like a long time.
I believe that there is some that has come back, but I would say it's probably more for the Director of Public Health to actually give that information.
It's a long time, though, Mr. Ashford, isn't it? I mean, it's a long time for this information, surely.
Well, the UK labs actually shut over Christmas and New Year, while over here we continued working. In the UK, they actually shut down, so that's one of the reasons it's taken the time. I believe some of the data is back, but the important thing to stress again is it doesn't change our reaction. Genomic testing is important because it allows you to link cases back, but that's going backwards. What we have to do in an elimination strategy is actually cut the future chains of transmission. And that is through contact tracing of positive cases, because, of course, genomic testing the all you can test is the cases you know about because you've actually got the sample that says it's positive. What we want to do is cut off any future transmission, including asymptomatic transmission.